Hello, this is our presentation over self-harm. My name's Mary Guzman.
My name is Montserrat Rubalcaba.
My name is Ashley Jerome.
My name is Saul Barwin.
Jesus Lupercio.
My name is Juan Martinez.
So as we discussed, we're going to be talking about self-harm specifically in adolescents. Let's go over, even though we all kind of have the general idea of what self-harm is, let's just go ahead and say self-harm is the intentional self-poisoning or self-injury, irrespective of the type of motive or the extent of suicidal attempt. It is the third leading cause of death in the U.S. and is a strong predictor of both attempted and completed suicide. There are many factors that can contribute, such as genetic vulnerability, psychiatric, psychological, familial, social, and cultural factors.
There's many reasons for committing an SSI. The main thing is that self-harm acts as a coping mechanism to deal with emotional stress, and people who attempt an SSI seek it because it can provide a sense of relief. It could create a distraction from life's problems. It could be as a form of punishment for oneself with maybe if you have low self-esteem, inflicting that on yourself, or someone experiencing emotional numbness might participate in self-harm in order to feel something.
So let's talk about how there's two differences of self-harm. There is non-suicidal and suicidal self-harm. So non-suicidal self-harm is the intentional destruction of one's body tissue without suicidal attempt. It is more prevalent, involves many different methods, and results in bodily harm that is less medically severe and that causes less lethal damage compared to with suicide attempts. It is typically associated with emotional and psychiatric distress, and it can increase the risk of suicide. It is most common among adolescents and young adults, and the rates are highest among people who suffer from psychiatric issues or mental health issues such as depression, anxiety, and many more. General population studies have shown that there's an equivalent rate between men and women. However, there is a difference between what methods they choose, such as women resort more to cutting and men resort more to hitting and burning. Suicidal self-harm is ultimately committing self-harm to the intent to commit suicide, and this can either result in attempts or, sadly, the completion of suicide. And once again, not everyone who self-harms intends to commit suicide, and not everyone who is suicidal commits self-harm.
So the statistics I had found in one research study showed that about 17% of teenagers engaged in self-harm at least once in their lives. There are many teenagers who do self-harm, and they tend to do so between the ages of 12 and 14. With these ages, there are kids that are barely entering middle school, high school, and they're experiencing new things, new environments, and are meeting new people. So these could also be factors as to why they do inflict self-harm on themselves. When this occurs in adolescence, it can create new mental health disorders as well as greater risk-taking behaviors. And in this research study, it was also shown that about 53% of youth in the study had reported engaging in SSI over their lifetimes. And of the 53%, there were 17 that had reported engaging in NSSI only once, while 36 had reported engaging in multiple instances of NSSI over their lives as well.
Self-harm in adolescents. It can start from the third grade all the way to high school. Just like Mary mentioned, it's most common during the middle school years. But why do adolescents or teens do this self-harm? It's to decrease levels of stress, levels of anxiety, and they want to feel less overwhelmed. Sometimes teens blame themselves from everything that's going on around themselves, like family issues or school issues, their group of friends issues, any kind of issue, relationship issues. So they feel like they deserve that pain, so they tend to do this method of non-suicidal self-injury, and also they want to call for attention and care from their loved ones, like their parents, but at the same time they want to hide it from them. So it's kind of like a inner battle within themselves. And also many teens are exposed to social media these days. So social media is linked to an increase of depression among young teens and adolescents. So they're exposed to these methods. They probably receive they are exposed to like images, everything, videos from this type of non-suicidal self-injuries. There's also like a series about this girl that committed suicide. It's called 13 Reasons Why. Many of you have watched it. So teens are exposed to this type of issues.
For management and treatment, it's always good to tell someone about the problem to get help. Also, treatment is based on mental health condition of the patient. The treatment of self-injury behavior can take time and it's hard to work on it. And it's depending on the desire of the patient to recover. Also, the treatment includes the importance of mental health like psychotherapy, identify underlying issues, learn ways to control emotions, improve relationships and social skills, cognitive therapy, medicines, behavior therapy, make a safe home environment, find support, take care of yourself, and mental health is very important and it's always good to reach out for support and help.
So there's certain signs to look out for, and not all of them have to do with NSSI, but it's just specifically because of the age range. You have to notice things like bullying, social media, any big changes that happen in life. There's a lot of reasons why it's specifically that age range. A lot of times because mental health disorders tend to pop up during early to late adolescence, whether it be anxiety, depression. There's a high comorbidity between NSSI and mood disorders and eating disorders as well. There's also some research suggesting that eating disorder behaviors such as purging can be considered a form of self-harm. But the general signs tend to be depression, anxiety, any sort of mental health disorder. There's also a feeling of isolation and hopelessness where people that are committing NSSI sort of start to detract themselves from the normal relationships and start becoming more quiet. People can also experience lots of mood changes and very extreme feelings. They might start wearing long clothes to specifically hide NSSI, for example, like the scars or whatnot. And there's also certain things to look out for. People that are neurodivergent are a little more prone to actually committing NSSI. People that might have ADHD or some form of autism, but it's important to notice that while it does come into the NSSI discussion, there are certain things, especially when you get into the autism spectrum, that make it a bit more complicated than that. But just overall, when experiencing a difficult situation, it's important to look out for NSSI and just overall mental health disorders.
Cool. Also, I think we can all agree here that it is very important that self-injury is a serious issue, and seeking professional help is strongly recommended. Here in El Paso, Texas, there are several resources available for individuals who engage in self-injury. For example, University Medical Center of El Paso. This hospital has a behavioral health clinic that offers psychiatric evaluations, medication management, and therapy for individuals with mental health issues, including self-harm. You can reach them at 915-544-4000. Another resource that I found was really helpful was the El Paso Suicide Prevention Hotline. This hotline provides support and resources for individuals who are struggling with suicidal thoughts, which can often be related to self-harm. This number is 915-779-1800. Also, it's very, very important to improve the quality of life when you're going through this. You can seek professional help. Consider reaching out to a therapist, counselor, or mental health professional who can provide support and guidance. They can help you understand the underlying issues leading to self-harm and develop healthier coping strategies. Also, try practicing self-care. engage in activities that promote self-care and well-being, such as exercise, meditation, hobbies, and relaxation techniques. Taking care of your physical and emotional needs are crucial to your recovery. Also, remember, seeking help and making possible changes and positive changes takes time and effort, but it is possible to improve your quality of life and find healthier ways to cope with difficult emotions.
And to add on what Saul said is that it's very important to resist the urge of isolating. Especially, you need to have a support system, and whether that might be a friend or whatever it may be, that can really help curb some of the negative behaviors. And to add on, there's a lot of really good resources, both locally and nationally. There's a lot of there's the National Suicide Hotline, there's a crisis text line, there's things like the Trevor Project and whatnot. But here locally, we also have NAMI, the National Alliance of Mental Health for El Paso. We have the Emergence Health Network, that is the mental health authority for El Paso County. There's also many behavioral health hospitals like Rio Vista Behavioral Health Hospital, El Paso Behavioral Health Hospital, many others that provide both inpatient and outpatient services that help curb suicidal ideation and SSI.
We would like to take this time to just bring up what this whole podcast, the message behind it, and that is, if you notice the signs, whether that's with a friend, a loved one, anyone, please help them get the help that they need. It is not a sign of weakness to seek out help. I know in society, most of the time we view it as that, but it really isn't. And if you are suffering from suicidal ideations or even thinking about self-harming, please reach out to any of the resources we have below, or even bring the topic up to friends or family or someone you trust.
I think one more thing to add on to that is that there's no shame in trying to find help for yourself. If you are struggling with suicidal ideations or self-harm, it's always encouraged to seek out help and to get that professional help for yourself and for your mental health as well.
The stigmatization, it really prevents people from getting help, and it really shouldn't. There's a lot of cultural factors that are preventing that, but it's important to realize if you need it, you need it. And
So I think with that said, this concludes our podcast, and I hope you all enjoyed.
thank you.
Thank you.